Patient and public involvement is increasingly seen as being important for all kinds of research, but I think it's particularly important for patient safety research. If we're trying to think about how to make our health systems safe, we need to think how patients see that and how they think we can make our healthcare systems safer.
I think patients bring normality to the situation. We have both feet on the ground. We are consumers of the product, and therefore we know what we want the product to be. And we help, I think, probably to steer the academics away from absolute science and to make the whole thing much more digestible.
I got involved through a colleague who worked in the NHS and was working here and kicked off a research project. I'd been a consumer of health services, as had my mother and my brother, and so she felt that combination of first-hand and second-hand experience would be useful.
I got involved through a friend of mine who was a professor, and when I read the person spec, I realised that I fitted most of the categories.
There's lots of different ways in which patients and the public can be involved in research. It might involve steering the direction of the research, or it might involve things such as data collection or contributing to how we interpret the data that we get.
I feel passionately about the health service and you know what a great thing it is, so anything that I could do to help, I was keen to get involved. Having stopped working and effectively being retired, although in inverted commas, I wanted to do something that would keep me intellectually stimulated and actually add some value, if you like.
I was motivated to get involved because in the end we're all patients. I wanted something else challenging to do, both challenging, interesting, and something that might make a difference to citizens who use the National Health Service.
I think the researchers get a huge amount out of having patients and the public involved. We get a sense of what matters from a public point of view. We get complementary perspectives to the researchers. We sometimes learn a lot from the previous experiences and perspectives where people have worked or experienced in the past, and we're often challenged in a good way.
I'm not entirely sure whether I personally have made a difference. I'm sure that the studies that I've been involved in will make a difference ultimately.
As patients, we almost get more credibility, more sort of, we are more listened to than maybe other people in the medical profession, because I think we do bring that different perspective. And I've got much more involved and spent more time on it than I probably anticipated I would, largely because I enjoy it so much and I feel that I am adding real value.